Hi, good morning. I begin as a, nursing manager. So my key role involved, recruitment of nurses, training and induction of nurses, and also the nursing operations. So within 6 months of my first role, I was given this opportunity of implementing NABH. So I think many of you must be familiar. That is National Accreditation Board for Hospitals and Healthcare Organizations. So it does, give you a certain set of standards that you implement at the hospitals. It's based on like JCI, and you improve the quality of care for your patients. So I definitely took up the opportunity. I took some additional courses to keep myself updated with the current standards, and I went ahead with this like great opportunity, and I was promoted to the level of manager operations and quality. And by God's grace, though it was like a very challenging role for me because everything was kind of new, but we were able to get accreditation in a couple of years after facing 4 external assessments by NABH surveyors. And it was a big win for me personally because this was a very, very old hospital. It was earlier known as Saket City, but it comes under the Max umbrella now. And so there was a lot of like change management and change navigation that we had to do at that point in time. Once I was done with that role, I felt like, okay, I have enough learned here. What should I try new? So I started exploring healthcare consulting. Is there any issue?
No, nothing.
Okay. So, and I'll tell you a very interesting story of how I got into consulting. So one of my dear friends, he actually sent me a screenshot of his offer letter saying that I got a role with Deloitte, but I'm not going to pursue because it involves a lot of travel. And I'm like, wow, this guy is getting paid so much. And what does like these consulting companies do? And I looked into it and like how they work into strategy and operations and provide guidance to basically businesses to improve their performance. So I reached out to the HR and I figured out about healthcare consulting, and that's how I got into Deloitte, which is a big 4 consulting firm, and I was catering to the US healthcare market. So though I was like based out of like India, but my clients were in the US and I would often travel to the US. Once I finished that part of my career journey, I went to Canada because obviously I got married and my husband was in Canada. And I faced the same struggle as any newcomer to a new country would face. I was asked like, oh, do you have Canadian experience? And it was such a chicken and egg cycle. And unless and until I have a Canadian job, how can I have the Canadian experience? So I started my career there basically with a startup into marketing and business development. It was a home care assistance business, and I would actually liaison with governmental authorities, primary care physicians to get clientele to our home care business. It was a very, very interesting role. I learned a lot in that particular role. And it was only after a few months being in that role that I got an opportunity with the public healthcare system, and that I was eyeing for. So I worked for the Canadian public healthcare system, I would say, for 5 to 6 years. And my role was around like clinical quality improvement, performance improvement. I was lastly a director for a seniors living entity. So like basically for a group of seniors living facilities across Alberta and Canada. And my role mainly included to like, implement clinical standards and improve the quality of care that we delivered across different, seniors living facilities that we had in that region. So, well, it was going all smooth. And then there comes an opportunity for my husband to move to Saudi Arabia. It was a great role and we could not say no for that. And also because it was closer to home for us and our parents live in India. So we decided that, oh yeah, it would be a good move for us to go to Middle East. And but our condition was like, unless and until I figure out what's the healthcare landscape, because after having changed different countries, I knew how difficult it is to like make that kind of move. So I started networking, with different healthcare leaders here in Kingdom of Saudi Arabia. I did like, connect with the leaders in the private healthcare landscape, as well as like the public healthcare landscape. And I was able to figure out a role for myself into the strategy and planning vertical of Ministry of Health of Kingdom of Saudi Arabia. I was an executive director for above a year there, and then moved on to starting something of my own. I did a small gig of having my own consulting firm, and then coming to my last role, that is like the population health transformation. So I'm currently with Johns Hopkins Aramco Healthcare, which is a joint venture between Saudi Aramco, that's the world's largest oil company, and the Johns Hopkins like Medicine International, that is based out of like Baltimore, Maryland. So we are looking at though like population health is an established concept back in the West, but it is a newer concept here in the Middle East. So we are looking at risk stratification of the population, seeing how we can improve the long-term, health outcomes of our population, as well as reduce the liability in terms of cost for our population. So while I was on this, my career journey, I definitely had to upskill myself. So I had a bachelor's and master's from AIMS, but I also did a postgraduate diploma in hospital management, did a certified professional in healthcare quality, certified associate in project management, did a couple of other certifications like PROSI, IHI, AHA, different, so that I fit into these roles and deliver my best. So that's in a nutshell of my career journey. And my biggest two lessons is never be afraid to, network, reach out to people to understand what a particular role does look like. And number two, dance on the chance, right? If you get an opportunity, grab it with both of your hands and deliver your best. So the healthcare, as I mentioned earlier, also the healthcare landscape is changing, and so is the landscape for nursing too. There's a lot of technology integration in terms of we are using AI, we are using predictive modeling to understand what would the patient outcomes look like after a few years, or what would be their health outcomes. Robotics is there. We are implementing a lot of electronic health records. We are using telehealth and virtual healthcare pathways. So that creates a lot of different opportunities. There are evolving care models. So the kind of patients that we used to probably cater to 10 years ago are very different than what we cater to now, right? Because people are more knowledgeable, they have more access to technology, they can figure out, their own answers to some extent, and they have more questions for us. And so we want to deliver in a way that is evidence-based, value-based, as well as improving the long-term population health outcomes. Expanding a scope of practice. Given that there's a crunch of healthcare professionals across the globe, be it doctors, be it nurses, be it allied healthcare staff, we need more of people who can cross-functionally work. So maybe a nurse who can also work as a case manager, or also can fit into the health coach kind of role, so that we don't have to keep hiring new people. So that's expanding the scope of practice for nurses. Then there are global healthcare challenges. You all know that the chronic diseases are on the rise. Also, there's aging population across the globe and health disparities. So that creates ample of opportunities for us to deliver better care. So I'll start first with clinical practice. I know you must have, and also I just wanted to put in a caveat there, that most of my experience last decade, over a decade, has been in different countries. So my presentation is from a very global point of view and not just primarily focused on India. I know most of us are global citizens these days, and we travel and immigrate to different countries. So I'll have that global lens in whatever I'm presenting. In terms of various advanced clinical roles, I'm sure you have heard these terms that I have put on the right, like nurse practitioner, or the clinical nurse specialist, certified registered nurse anesthetist, or nurse midwife. So these are basically advanced practice roles for nurses. And I'll just give you a bit insight into what does a nurse practitioner role look like. So they are more like independent practitioners. They have got some level of credentialing and privileging where they can actually run their even own independent clinics, or they can be part of the hospital as well and working along with the team, but their privileges are higher than that of a registered nurse. They can literally, do the assessment, prescribe tests, and also order medications to a certain extent. So that's what a nurse practitioner is. A clinical nurse specialist, it can be in any field, like be it oncology, be it cardiology, geriatrics. So these are advanced practitioners, but they are more embedded in the system. They are basically consultants and resources for the nurses themselves. So I'm sorry, I just lost your view. Okay. Yeah. So that's the difference between nurse practitioner and clinical nurse specialist, that the nurse practitioner have some level of independence, whereas CNS are more embedded in the system. Then certified registered nurse anesthetist. I'm sure you have heard that name, CRNA. These are basically globally the most highly paid nurses, I would say. So they are independent, practitioners where they administer anesthesia. So they do the patient's assessment, monitor the patients during, while they are under anesthesia, and also like the post-care. They can work along with the team, or they can do it independently as well. Similarly, there are nurse midwives. There's like, I think like in Canadian and US healthcare system, we see a lot of nurse midwives. People just go to nurse midwives for their delivery. They can deliver at home. They can deliver babies in the hospital along with the team. In terms of preparation for these kind of roles, definitely a master's of nursing, a doctor of nursing in practice. There are specialized programs for NP, which is 2 to 3 years, and also for CNS, it's exactly the same, like 2 to 3 year of specialization programs. And many of these programs can be done along with your, regular job, like how do you manage it? And then there are other training programs, like, small certification courses if you're looking for certain field. These kind of roles are high in demand when I talk about like Canada, US, UK, Australia, or New Zealand. Coming to leadership and administration, there are different buckets. So like operational leaders, and that's where you can start your career as young, masters, students. Like once you finished your masters or bachelors, you can be like nurse managers or even nurse consultants at the hospitals looking at the operations, and then move on to a career path of, gradually climbing up the ladder and becoming directors or senior directors. There are definitely roles in nursing education and mentorship, like, nurse educators. Besides this, then you have like nursing executives, like CNO, Chief Nursing Officer, nurse executives, healthcare executives. So when I say healthcare executives, that means like in a broader term, like, for the whole healthcare system or even the hospital. So I've seen, in my last a decade and a half of my career journey, I have met, many, many VPs, CEOs, and CEOs who are basically nurses from background. So some of the qualifications that do help to cater to these roles are like MBA, MHA, MSN, that many of you will be completing, CPHQ, that is Certified Professional in Healthcare Quality, and CHE, that is Certified Health Executive. So different countries have got different CHE programs, and it's like a labor-intensive 1 or 2 year program, and that is done after you have certain number of years of experience in your regular leadership role, and that's how you become a CHE. Here I have a picture of a couple of like very well-known nurse CEOs, and this I got actually these are snippets of the interviews from the American Organization for Nurse Leadership. And Candice Saunders is the CEO of Wellstar Health. And the question that was asked to her was like, how do you translate nursing skills to fit to the CEO role? So, and that what she answered was like, nurses approach patients and people in a holistic way. They listen to their patients and honor their choices. So this is the skill set that she, translates very well to her CEO role. She tries and spend a good time listening to her team and getting the right team together to achieve the organizational objectives. Then Janice Espiso, who is a nurse by background, but later on did her master's in public administration. She's president and CEO of UCLA Health, University of California, Los Angeles. So the question that was asked to her was like, what is your advice to nurses who have leadership aspirations outside nursing? And she said, like, get involved as much as you can. So if you are like, let's say, if you're a nurse on the unit, or if you're a charge nurse, and if you are presented with an opportunity to work on a special project, I would say like, go, like literally grab it with both of your hands. And that will provide you, a lot of experience as well as expertise to different set of work, and also will increase your visibility in terms of your senior leadership, and definitely your chances of doing well in your career would increase. So show your enthusiasm and people will notice always. Let's talk a bit about healthcare consulting. I know many of you may have like cousins, friends who are engineers and MBAs, and they do talk a lot about consulting. We hear these terms all the time. So what is consulting basically? So consulting is like, these are advisory firms that do, work with hospitals, governments, and companies to improve their, efficiencies, operations, or healthcare processes. They're primarily focused on strategy, operations, and analytics. So the kind of skills that you require for it is like data analysis, problem solving, and process improvement. The background is like you can have an MSN, MHA, MBA. Some of the certifications that would help you in your healthcare consulting journey is Lean, Six Sigma, PMP, CPHQ. So PMP, not sure if you guys know, it's like Project Management Professional. It's a certification by the Project Management Institute. So like you can take some courses on Udemy and then go and give the exam on the PMI Institute. And that's how you basically get a PMP. I just want to talk about some of these top consulting firms. You may have heard of MBB probably. So that's Bain and Company, McKinsey, and BCG. These are the topmost globally recognized consulting firms, and they are also called as the Big Three. And besides that, we have the Big Four also, that is KPMG, PwC, Ernst & Young, EY, and Deloitte Consulting. So these are, I would say, generic consulting firms. They are not like primarily focused on healthcare, but they do have like teams and verticals that do work in healthcare. So if you like probably want to read more about it, then you may want to go to the websites of these companies and look for, healthcare vertical under these companies, and that's how you'll figure out. I'll tell you like the basic career journey that happens in a consulting firm is like you started at an analyst level, move on to a consultant, senior consultant, manager, senior manager, and a partner kind of level. It's like fantastic. Consulting is fantastic, but it does involve long number of hours, like 14 to 16 hours at the beginning of your career. And I've done that. I've been there, and it's nothing but easy. Okay. Like you have to put in a lot of efforts onto your communication, analytical skills, and presentation skills. So those are the key skills that are required for consulting. There are certain companies that are healthcare special focus. So that's GE Healthcare, Equivia, Clearview, Accenture Health. If you've heard of GS Associates, they work mainly in the pharmaceutical space, but they do hire nurses as well. Then there's Alvaraj and Marcel and Oliver and Wyman. A key tip from my side for you guys would be, like, if you want to go into healthcare consulting, I would suggest that you start from the very beginning. Like immediately after your bachelor's or master's, you start applying to these firms, and then you can grow right from the very beginning level, because since it's consulting is an acquired skill that you learn over a period of time with your experience, so that increases the chances of your growth in the industry. Okay, let's talk about quality and patient safety. This is one field that's very near and dear to my heart because I did work in quality for a very long time. So there are different quality improvement consultants in the hospitals or healthcare system who improve processes and performance using the Lean and Six Sigma approach. They can be like basically nurses and with some additional certifications. Similarly, you have patient safety consultants that look into like patient adverse events. So what they do is like they aggregate all the adverse events and then review with a committee. So like false medication errors, sentinel events. And I'm sure like this, since like many of the organizations in India are now NABH accredited, we have patient safety consultants there as well. Then there are roles of accreditation consultants and advisors. So people who have done some kind of like assessor course or implementation course with NABH, JCI, the accreditation bodies like Accreditation Canada. They are more like internal advisors to the hospitals of how the staff can apply the standards that are prescribed in the accreditation booklets to translate into like real results. Some of the certifications that you can take for them are like CPHQ, that is Certified Professional in Healthcare Quality. There are some courses offered by Institute of Healthcare Improvement, IHI. This NABH implementation course available back in India as well. Some of the degrees that do help is like MSN, MHA, MSN Healthcare, MBA. So on the left-hand side, you can see I put a couple of logos. So the first one is of the NABH that we have in India. Clinical informatics and digital health, as we already, as I already spoke, like how digitization is changing the entire view of our world. There are roles, in electronic health records companies, like the nurses can be implementation specialists, they can be clinical consultants. So what they help doing is like taking the needs of the clients and translating it for the technical team, because technical team are the people who do not understand what the doctors and nurses want, and so they're the role of the nurses do play in. So they can be implementation specialists, clinical consultants. Some of the companies are Epic, Meditech, Cerner, Allscripts, Dell, and Oracle. Let's talk about healthcare tech startups. There are many, tech startups that are starting in telehealth or virtual health. We have a lot of work being done in the wearable technology and the app space. We are using a lot of AI-driven diagnostics and also like, analytics and predictive modeling. So some of the roles that the nurses can fit in well is the remote triage nurses. Suppose I'm a nurse and I can be like literally sitting at my home and getting, a question from like this is from a patient, like, okay, this is how I'm feeling. And so as a remote triage nurse, I can, ask them a set of questions to detect, to assess their triage criteria. And I can advise them accordingly that you can go to the primary care or you should go to an urgent care or to an emergency right now. There are nurse navigators that help you like navigate the healthcare journey remotely. There are counselors like for some of your mental health apps. So psychiatric nurses play a great role there. Some of the companies that are working in this space are like Teladoc or Cure AI. Cure AI has also started in India. They are doing like lots of work in AI-driven diagnostics space in India as well. Let's talk about nursing informatics. So like we know like data and analysis, analyzing the data, but what is informatics? It's like taking that data and converting into actionable items in form of patient care. That's like informatics, how you inform the data. So the nurse informaticians is one role, and clinical data managers is another role. And there are like multiple roles in this space. I've just given a couple of examples. There are always like lots of vacancies posted on WHO website or some of the NGOs or public health authorities as well, to have people who have got this kind of experience. There are different kind of certifications available for informatics that you can always like look up and take if you're interested in this space. Let's talk about some of the other emerging roles. There are specialized fields and like school health nurses, community health nurses, like who are based out in the community and providing some kind of, advocacy or care or education. Then home care nurses, as you are all, very well versed with, they provide healthcare in the home care space. Case managers. So case managers are basically nurses who are trained in case management, how they provide support to patients who are complex in their needs and have multiple chronic diseases so that we can keep them out of the hospital as much as possible. So how do you manage a case? Like, you start from their journey of like what tests need to be done. So they basically have a particular case load that they got to manage as case managers. Flight nurses, this is a newer concept, but a lot of flights, I would say like bigger flights, do absorb nurses. They prefer nurses as, their cabin crew staff because in terms of like providing any kind of emergency care, these flight nurses are, really competent. Forensic nursing is basically in the space where their crime has happened, or these nurses are basically specialized in going in, collecting the evidence, and, like interpreting, as well as like, assessing the victims of any like crime scene. Genetic nurses are trained, and I'm not talking like these are not like very long courses. These are literally like, month-long courses that you can take and, venture into this, space or career path. So genetic nurses basically deal with like genetic diseases, and they do like, evaluate the patients of what kind of genetic testing needs to be done, some kind of counseling. If I talk about the Middle East, genetic nurses play a big role because consanguineous marriages is very prevalent. And if there are consanguineous marriages, the chances of the genetic disorders definitely increase. So there is something called as like high risk couple counseling. That's where the genetic nurses are involved here. Medical legal nurses. So one of my close friends back in Canada, she was basically a nurse by background, but then she did study her law. And she was practicing healthcare law. And she did that practice for a couple of years. And then she was part of SE Health, one of the organizations I did work with. And she was the chief legal officer or chief compliance officer. So they look into like data and privacy and compliance from the legal point of view. So these are some of the specialized fields that nurses can draw in. Another one is travel nursing. This is a highly recognized and highly paid field, I would say. Basically, travel nurses are the nurses that are registered with some travel company. I'll give you like more clarification on it. So this concept is mainly in the US, as well as in some other countries like Australia. This is basically to bridge the gap between the supply and demand. So like, let's say it's a flu season, we are facing an acute shortage of nurses. As a hospital manager or administrator, I'll reach out to a travel agency to see if they have got some nurses on their panel. So definitely these nurses would be provided like twice the amount of salary of a regular nurse, and they would be provided accommodation and like flights to come to that particular hospital for that particular season, let's say, like, and these are like small term contracts, but then you do not have a base. You are just like constantly moving. So it's good for people who love traveling and who love to explore new places while, making some extra money on the side. Let's talk about population health. And this is one space that I'm right now into. It deals with, population stratification, risk assessment, doing, preventive health campaigns, as well as like across the continuum of care, how can we better the population health? So like case management or transitional care, like from hospital to home or hospital to some kind of rehabilitation facilities. So there, the nurses can act as population health specialists, as well as like campaign SMEs. Mainly these campaigns, like if we talk about the public awareness campaigns in the West, are a lot run by marketing team but then they have the SMEs from the nursing side on these campaigns who can provide them the insights into the patient's behavior, the kind of language the patients would want to hear. So that's how the nurses play a part in population health. Biotech and biomedical, I'm sure you have heard of like many companies like Johnson & Johnson, BD, Baxter Dixon, and other biomedical companies. So the nurses play a big role in being educators, being product managers, and also being business development. Being in Canada, I used to see a lot of nurses who used to come and like provide training on the infusion pumps or ventilators to our nurses who would be basically nurses by background, but they would have like experience in ICU or critical care setting before they actually ventured into the biotech or biomedical space. Research and innovation. A lot of like, nursing care is based in evidence-based care and like research basically and publication. So there's a field that is specifically for nurses, that is research nursing. A lot of nurses also these days go into medical writing because a lot is published these days onto social media as well as on the websites and also from the scientific point of view, like the scientific papers. So they do a lot of like medical writing, which can be done remotely many a times too. So this does not encompass everything, but like the key roles that I've seen in my, decade and a half long career journey. I would say some of the essential skills that you need to develop your career is like critical thinking and problem solving. So always like think critically and see like how can I solve the problem that is the most relevant to my patient or to the population. Adaptability and lifelong learning. So this is the love that you should have. That, I'm wanting to learn a new skill. I'm wanting to develop my skill set and, I'm ready to take some new courses and always like ready and eager to learn. Dancing on the opportunity attitude, I cannot emphasize on it more because I feel this pays so much. Like if an opportunity comes to you, it might look like some kind of additional work at that point in time, but over a period of time, you will see that it pays in the long run. Digital and business literacy, like keep yourself always abreast with the, newer research work or publications that's being done. Interprofessional collaboration is always desired in whatever role you go into. I'll just quickly talk about the key career tips of enhancing your career. Like, first of all, build a very strong resume. Always highlight whatever experience you got, whatever certifications and research work that you have done. Never just like apply with the same resume for all different roles. Tailor your resume for different roles. Use action words like this is what I've implemented, led, like more from the point of view, like I led this and this led translated into this result. So when you're writing your resume, make sure that it is ATS compliant. So ATS, not sure if you guys know, it's called as applicant tracking system. So most of the companies do use a ATS tracker. And so they say like how many of the words from the resume match the job description. So they have some kind of, inbuilt algorithm. So I would say like always make sure that your resume is ATS compliant. There are many, online forums available to, make sure that your resume is ATS compliant. Network and build professional relationships. So like join different nursing organizations, attend conferences and workshops, seek mentorship. If you find someone who you feel is your role model and you want to, go in that direction, reach out to them and do seek their mentorship support. Network. I cannot emphasize on this. Out of so many roles that I have done across my career, I have landed, I would say 50% of them through networking. So many a times, some of the big roles are not even posted on the website. They are backfilled, like once someone joins and then they are put into the system. Optimize your LinkedIn profile. I'm not sure if all of you are on LinkedIn, but I would say that's the starting point. Get onto the LinkedIn, and use it more than your Instagram profile. Use a professional photo and a clear headline, like, what do you want to achieve? Like, you're an aspiring nurse leader or a future healthcare consultant. Write a summary, showcase your skills, experience, and what are your long-term career goals, and engage with content. So like, follow the healthcare leaders, share insights, and participate in discussions. So consider further education and certifications. I have elaborated on like most of my slides as to what kind of, courses or degrees you must be taking to go into different fields. So I would just say that the future of nursing is like super bright. Be always open to new opportunities and exploring diverse career paths, and stay adaptable. Nurses are at the forefront of the change whenever there's change happening in the healthcare. This was like my entire topic. I have just one more learning lesson that I learned in my career was, when I was moving countries, I gave up my nursing license. And I think that was like my biggest mistake. So when I was moving from India to Canada, I got a role that was into quality improvement, clinical excellence, and it really aligned with my professional long-term goals. And I thought, like, yeah, because getting a license in Alberta was some time of investment, like be it financial or like I had to take additional training. And I thought like it will be too much work. I was starting with a new family and everything. So I did not take my license. And I feel I did that as a mistake, because if you're a registered nurse, your chances of growth definitely doubles up. And how you can keep your license active is like you can actually have like some shifts on the side and like practice as a casual nurse in some of the hospitals. I know this concept is not there in India, or maybe like it is there now, like being casual nurses. So that way you can be in an administrative role, whereas like doing your minimum number of hours every year and keeping your license active. So that's I really wanted to be honest with you guys, and I wanted to share that. I hope you take the learning lesson from it. I have personally kept the colors in this presentation super bright and bold to convey that always be bold in your actions and bright in your impact. Know what fuels your passion. Like, what gives you the kick, right, of doing well in your career. I know you will, as like young students, you may not be able to figure that out like right tomorrow, but, have just like a long-term vision in mind and steer in the right direction. Lead with compassion, resilience, and innovation. So that's about it. And thank you so much. I have my email ID here, and I also have a QR code of my LinkedIn profile if you guys want to send me a request there. I do not know what's the time right now. I think we have another 15-20 minutes, and I'm happy to take any questions that you guys have. I think we've finished great on time.
So thank you so much, ma'am, for this wonderful session and for your valuable insights. Now we open the floor for discussion. If you have any questions related, so you can ask one by one. You can come forward here and you can ask questions.
Any questions? No questions? Anybody? Huh? Yeah,
You can come forward.
how many of you want to go abroad? Raise your hand. No one.
Good afternoon, ma'am.
Good afternoon.
Thank you, ma'am, for the session. Ma'am, I wanted to ask, like, if we are going to complete our 4th year, and after this, we have known that there are many aspects of nursing and many opportunities. So, what factors we should keep in mind while choosing the career in nursing? Like, how it will affect us? I wanted to ask, ma'am.
That's a fantastic question. May I know your name?
Ma'am, my name is Nikita.
Nikita, that's a wonderful question. So some of the factors that you must consider is, I would say, like, there are some personal factors also, like what does align with your personal goals. In the long term, what do you see yourself doing? I'll give my own example. I always wanted to see healthcare systems in different countries. How do they operate? I always wanted to feel like, definitely nursing is my first love. Clinical nursing is my first love, like any one of you. But I also felt personally, I struggled in clinical nursing because I used to have a lot of transference feelings. Like I would get attached to my patients and I would like literally cry whole night. So I figured out very early in my bachelor's and master's journey that I'm not a, a big fit for the clinical nursing. I could not do bedside nursing. So it like the factors I would say should be aligned to your personal goals and personal evaluation of strengths and weaknesses. And also, I would say what fuels your passion, basically what gives you a kick. Yeah. Or I would also put in there that always look on the financial side of things too. As nurses, we are like, it's inculcated in our mind, like, oh, like, always about the patient. And yes, like we'll always keep patients at the forefront of whatever we do, but yet we should be getting the work that that we deserve. So keep the financial aspects also into mind. I've never seen a white guy or a white lady come to me and say, no, I'm just doing it for the sake of fully passion. You need incentivization in some sense.
Okay,
Yeah.
thank you, ma'am. Thank you for your answer.
Anyone else? Any other questions?
Hello, ma'am.
Hi.
Ma'am, I am Namrata. I'm MSc second year student, and I'm community health nursing specialty. I'm from community health nursing.
Oh,
And
wonderful.
thank you so much for this wonderful session. It was really marvelous. And I wanted to ask that what are the future, what does we hold as future in abroad as in teaching? What future do we hold in teaching in abroad? As you told that you were in consultancy also, so that's
Yes,
why I'm
yes.
asking.
So yeah, absolutely. Thank you. That's a great question. And I'll tell you how the teaching is structured in hospitals versus the universities. So in the hospitals, we have nurse educators, on all the units. So they are basically nurses who are very skilled. They do some kind of, additional certifications, in delivering, adult education, some kind of like trainings, and then they are embedded on the units. And so whenever there are new nurses being hired, they mentor them. Whenever there's like special cases, they just go and supervise them and provide on the job, on the site kind of nursing training. They do have like classroom trainings as well, but they're like more present and embedded in the system. So that's the hospital side of things. If you talk about the university side of things, so if you are like master's students, and like when you have to go abroad, like you'll have to clear some exams, that NCLEX or UK has got a different, examination criteria. You have to get the licensure in that country, and then you can get started from there. You can start as like a junior, professor, like called as assistant professor, move on to the professorship, and you have to advance your educational qualifications sometimes from the perspective of the country that you are moving in. So you may want to go for a doctorate degree there or like another master's degree. There are courses that are like MS PhD. I know some of our students who have done MS PhD. Like it's a combined degree of master's as well as PhD. It's like 4 to 5 years. And while you are doing that degree, you are being paid as like, if you do some additional side work, if you're an assistant teacher or something, you make enough money to sustain yourself while you are working, towards your master's or PhD degree. So definitely there is a scope in it.
Okay, thank you, ma'am. Also, can we do teaching in abroad after doing MSc from here? Because I have heard that it is not valid for nurse
See,
education post. Is it so?
I know one of my closest friends. She's teaching. She did like her bachelor's and master's from AIMS. Her name is Medha Piplani, and she's like one of my closest friends. And she did also her PhD from the consortium, and she is teaching in the UK. Yeah. So it also depends on the opportunities that you get and how flexible that particular university is. But it is sometimes challenging, to be honest, with your Indian degrees. So you have to sometimes upskill yourself. Yeah.
Thank you so
And
much.
that you can do while you are working also. Like you can be working part-time somewhere at the side. You can have your degree going on too.
One last question, ma'am. As you have mentioned, there are upskilling degrees like IHIP and CPHQ. So can we
Yeah.
do education even if we are living in India, and can we do?
Absolutely, absolutely. So CPHQ is Certified Professional in Healthcare Quality. Anyone sitting across the globe can do it. So if you go on their website, they have the process of international candidates and the national candidates. So it's based out of USA, but I did it while I was sitting in Canada. I know people who have done it back in India too. So you have to take some, lessons on the side. And I think Udemy is a very big, very great platform, and they have like really cheap courses. If I'm wanting to prepare for CPHQ, they will have a course available like literally in 2,000 and 4,000 Indian rupees, and you take and prepare from those classes, and then you go and appear for your exam. And most of these exams are like virtual. So even your like the PMI Institute, I said like Project Management Institute, so Project Management Professional or CAPM. So these are can be done remotely, and even IHI one.
And that holds the same value as that doing from the premises.
No, so these are mainly certifications, and they are not done in premises.
Okay. Thank you so much.
Degrees and certifications.
Okay, ma'am. Thank you so much. Thank you, ma'am.
Yeah.
Thank you, Namrata, for this interesting questions. Now, other questions? Please ask if you have any.
If no one has a question, I may have a question.
Yes, sure. Yes, please, ma'am.
So tell me, because I have been so much away from India for the last 10 years, I want to know how much of it is now being like, is now applicable in the Indian setup, like whatever I did talk about. I know about healthcare consulting. I know a lot of nurses in healthcare consulting back in India also, but rest of the fields.
I think we have Vandana also with us.
Oh, okay. I saw and I was curious. Is this my friend Vandana?
If she would like
Hi,
to speak something.
Hi, Vandana. I think she's on mute. Can
I
she
think,
hear us?
yeah, she had joined, but I don't know whether she's actually there. Okay. See, nowadays in the councils, no, they are telling that after 5 years you need to renew. So that is important. So unless they attend some conferences, their license will not be renewed. So that is something good happening. And nurse practitioner course is starting here, but not with so much of enthusiasm. In many private hospitals, it is happening, but there is not much support in the government institutes. Although we are trying. And in the syllabus, we have a lot of corrections that have taken place. Forensic nursing is added, nursing informatics is added, but there are practical applications. In many of the private institutes, they are growing slowly, but in the government scenario, the development is taking place at a slow pace. But you have good salaries in the government.
Yes.
That is the thing.
That
Yeah.
is the incentive. Okay, got it. Yeah.
Chalo. Anything else you want to ask?
Any more questions?
What did you learn today? Anything new you learned today? What? Who can say? Anybody can summarize? What did you learn today? Yeah. So the message is that you need to be aware of your surroundings, what is happening within India, outside India, and you have to keep on networking with people. Okay. You are using social media for other purposes, but you have to use it for educational purpose also. Has anyone, any of the MSc student has made their profile on LinkedIn? Only? How many? 3 out of 50. 3 have made. है ना? So you need to be upgraded, okay? And your communication skills should be very good. So you need to practice hard. You need to talk among yourself. How many of you talk in English when you talk to each other? How many of you do? So you have to do, okay? Because then only it will be approved. Now you see how nicely she is speaking. Actually, ma'am, I forgot that you are an Indian. I'm looking at your accent.
Nah, I know, like I picked up
Yeah.
on the accent. But yes, you're very right. बहुत ठीक बोला आपने, क्योंकि communication is one big thing to excel in any of the fields, I would say. So when I first went to Deloitte, you would not believe my first question after a couple of days being there was like, do you guys speak in English all the time? Because they would speak in English all the time. And I could not understand why, like being Indians, why none of them were speaking in Hindi. And I realized that someone told, like a close friend of mine said to me that, like, because we are going to the international clients to just practice and like keep our rhythm on, we speak in English all the time.
Yeah.
Yeah.
So the practice makes man perfect. Okay. So whether it is your clinical skills or language skills, you need to practice again and again. And we have a lot of AIMS alumni also with us. You know, a lot of our tutors, they are PhD, MSc from AIMS. Show your faces, no? See, we have Ritu and Vinita. I think they are junior. Do you know them? No.
No, I do not know actually.
Yeah.
She's like 2014, 15 pass out. I'm like 2009. बूढ़ी हो गई मैं.
2016 BSc and 18 FSC batch.
There are other
Yeah,
more also. They are busy in other clinical areas. A lot of
So
AIMS people have joined here. Yeah.
our inspiration was Spriti Di's class. Like, and also you were the first batch, right, of masters or second?
Second batch.
Second. So the first and second batch of masters were like amazing, amazing. We always looked up to them. They were so brilliant. Like I was a topper for my bachelor's and master's both, but was I the most intelligent? I was not. I was not. And these, when I used to look at our, some of my own classmates and also my master's, seniors, I would always be like, oh my God. And I'm so happy to see you, like, leading a big college of nursing be there. It's such a like proud feeling for me to see my seniors in such a great space.
Thank you. Thank you so much. And you were talking about Veda also, no? I remember her also. Even Veda, Sumiti, their batch was really very, very brilliant, and these are the role models you should look and learn from them. That's why the session has been held for you, right?
Thank you. Thank you for having me. Thank you so much, Dee. Okay.
Go further in the future.
Absolutely, absolutely. And if the students want to reach out me for any kind of like questions or guidance, I'm more than happy to provide that here.
Thank you.
Okay, thank you. Bye, everyone.
Thank you so much, ma'am, for this session. Thank you, ma'am, for having.
Totally my pleasure. Totally my pleasure. Thank you. Take care. Bye.
Bye, ma'am. Thank you, ma'am.